There are only few things which make CASC candidates more uncomfortable than silence. The patient stops talking, the room becomes quiet, and panic begins. Many candidates immediately start talking just to fill in the gap. But here is the secret: silence is not your enemy. When used correctly, silence can actually improve your CASC scores. Now let's explore how this happens. Patients become silent for many reasons. They may be they may be thinking, they may be emotional, they may be processing the information, or they might be unsure what to say next, or they might be discussing something painful. Silence often means something important is happening. The biggest mistake, most candidates do this. When patient becomes silent, candidate panics and candidate starts asking multiple questions. Candidate interrupts the reflection. And what is the result? The result is obviously loss of rapport and loss of empathy marks. There is a difference between good silence and bad silence. Good silence, for example, when patient is thinking or patient is emotional or patient is processing the information. Allow it to happen. But think about bad silence, like conversation has stalled, patient is confused, or probably patient needs guidance. Now, this sort of a silence requires a gentle intervention. There is a power of pause and use that power. So, one of the strongest communication skills in psychiatry is tolerating silence. Imagine a patient says, "My wife died 6 months ago," and there is a silence. Many candidates immediately ask another question. Don't do that. Instead, pause, allow space, and this demonstrates empathy. If silence continues, try saying things like, "I can see this may be difficult to talk about," followed by a pause, or "Take your time." Simple, powerful, professional. Imagine a situation where patient begins crying. Don't rush, don't change the subject, don't offer false reassurance. Instead, say, "I can see this is upsetting." Pause, say again, "I'm here to listen." And these phrases score highly in CASC stations. Sometimes patients genuinely struggle. They don't know what to say. So, in that case, use questions like, "What thoughts are going through your mind right now?" Or, "Could you tell me a little more about that?" Gentle prompts, but not an interrogation, works here. Silence after the bad news, and this is particularly important. If you have explained a diagnosis, a scan result, a difficult prognosis, expect silence. What you are supposed to do at that time? Allow processing time. Patient centered communication often involves fewer words, not more. Let's look at an example. Imagine the patient says, "I'm worried my family would be better off without me," followed by a silence. Candidate, after the pause, can say, "I can see that's a painful thought." Again, a pause. When patient continues to speak, notice the silence in this case has encouraged the disclosure. Examiners are looking for emotional intelligence, active listening, empathy, and professionalism. They are not looking for constant talking, no rapid fire questioning. Remember, the person who speaks first after silence often loses information. The patient may have revealed something important if given a few more seconds. These are some of the common mistakes which candidates can do in this situation. You must avoid interrupting silence immediately. Avoid asking multiple questions at once. Avoid changing the subject. Avoid becoming visibly uncomfortable because of the silence. And avoid talking continuously. So here is the silence formula. When silence occurs, pause, observe, acknowledge emotion, invite exploration, then listen. That's it. Let us have a quick exam scenario. Imagine your patient says, I'm scared I might never recover, followed by a silence. What could be the best response? You can say things like, I can hear how frightening that feels. Pause after that, then continue. Tell me more about that fear. And that is an excellent CASC communication. Silence isn't empty. Silence contains information. Candidates who learn to tolerate silence often build stronger rapport, gather better information, and score higher in CASC stations. So the next time a patient becomes silent, don't rush to fill the space. Instead, use it to improve your CASC scores. Thank you for watching. See you in the next video.